is Hong. I'm with BSN 346 and today I'll be performing the deep tendon reflex skill video. I have provide privacy for my patients by closing the door and pulling the privacy curtain. I have performed hand hygiene and I have positioned the patient appropriately for the assessment. Next up, I will introduce myself and verify patient information with via two identifiers such as name and date of birth. And then I will explain the procedure to the patients. What we'll be doing today is I'm going to use this hammer and I'm going to gently tap on 4 parts of your body: the bicep, the tricep, the patella, and the Achilles tendon. What we're trying to do is we're trying to elicit a response that can be measured. Typically, it performed on pregnancy patients to check for preeclampsia. For instance, if I tap the patella tendon and it has a hyperactive alongside with any other sign and symptom, it indicates that the patient had preeclampsia. But it typically can perform on anybody. It generally tests for the motor system function as well as the function of the upper and the lower motor neuron. And is graded on a scale from 0 to 4, 0 being absent, 1 being diminished or hypoactive, 2 being normal, 3 being hyperactive and brisk, 4 being hyperactive and brisk with clonus. And in the real world, it's typically performed bilaterally, but for the purpose of this video, I'll only perform unilaterally. So to start off, I will test the bicep tendon. So I'm gonna support the patient arm like this, have the patient completely relaxed, and locate the tendon with my thumb right here, and with the pointed side of the hammer, I'm gonna gently tap my thumb. I'll strike my thumb. Okay. And yep, that's normal. Okay. Now this is the tricep tendon. I'm gonna support the patient arm up like this. Have the patient completely relaxed, dangling. Yep. And then locate the tendon just above the elbow bone, and with the wide side of the hammer, I'm gonna gently tap it. Okay, strike. Okay, that's normal. And then now I'm gonna go do the patella tendon. Right, yep. So, gonna have the patient completely dangling the foot, support the behind the knee, and with the wide side of my hammer, I'm gonna just tap gently below the kneecap. Okay. Yep, that's normal. Next up, I will do the Achilles tendon. Again, support the foot, have the patient completely relaxed, and the Achilles tendon is behind the heel here. Yeah. And I'm gonna make sure I dorsiflex the feet. And with the wide side of the hammer, gently tap. Okay, the patient plantar flex, which is normal. And then lastly, I will check for clonus. What I'll do is I'm gonna dorsiflex the foot like this and let go, dorsiflex, let go, dorsiflex, let go. And as you can see, the foot just falling off unnaturally. That is normal, which indicate negative clonus. But if I dorsiflex and as the foot go down, it twitch or tremor like this, dorsiflex and twitch and tremor is indicate a positive clonus. Yeah. And lastly, I will perform hand hygiene, reposition patient for safety, and I'm gonna go document my result.